Get your career kick-started today. Welcome to the Career Channel. Please subscribe to the channel as it motivates us to keep bringing you great content. Thank you. Let's get started with the questions and answers. Remember to practice these, but build in your own experience and tell your own story when delivering your answers. 1. Can you describe your experience as a scrub nurse in a similar healthcare setting? Answer. I have a few years' experience working as a scrub nurse in previous healthcare settings. During this time, I've gained extensive experience in preparing and maintaining the sterile field, assisting the surgeon during procedures and ensuring patient safety. I have also dealt with a wide range of surgical specialties, including various specialties, which has helped me develop a diverse skill set. 2. How do you handle the pressure and stress that comes with working in a fast-paced surgical environment? Answer. Working in a fast-paced surgical environment is challenging, but something I'm accustomed to. I manage stress by staying organized and anticipating the needs of the surgical team. I also rely on effective communication with team members, remaining calm in emergencies and drawing on my experience to make quick, well-informed decisions. Additionally, I practice self-care and take breaks as needed to maintain focus and composure. 3. What protocols and safety measures do you follow to maintain a sterile surgical field? Answer. I follow strict aseptic techniques, beginning with thorough hand washing and donning sterile attire. I set up the sterile field, ensuring that all instruments and supplies are sterile. I maintain a close eye on the field during the procedure, and if there's any doubt about sterility, I address it immediately. Post-surgery, I ensure proper disposal of contaminated items and maintain the integrity of the sterile field. 4. How do you prioritize and organize your tasks during a surgical procedure? Answer. Prioritization is crucial in the OR. I start by reviewing the surgical schedule and gathering all necessary equipment and supplies beforehand. During the procedure, I maintain a mental checklist of the steps and anticipate the surgeon's needs. I also communicate effectively with the surgical team to ensure a smooth workflow, making sure we have everything ready for each stage of the surgery. 5. Can you provide an example of a time when you had to respond to an unexpected complication during a surgery? Answer. In one case, we encountered severe bleeding during a routine procedure. I immediately informed the surgeon, passed necessary instruments and supplies swiftly, and ensured the patient's safety. We successfully managed the situation, and I documented the incident for further analysis and improvement. This experience highlighted the importance of remaining composed and acting swiftly under pressure. 6. How do you stay updated on the latest surgical techniques, equipment, and best practices in your field? Answer. I am committed to continuous learning. I regularly attend seminars, workshops, and webinars related to surgical nursing. I'm a member of professional organizations and subscribe to medical journals. These resources help me stay updated on the latest advancements and best practices in the field. Seven. How do you handle patient and family communication before and after surgery? Answer. Clear communication with patients and their families is essential. Before surgery, I ensure that patients understand the procedure, answer their questions, and provide reassurance. After surgery, I update the family on the patient's condition and recovery progress. Empathy and active listening are key in these interactions. 8. Describe your experience working in multidisciplinary surgical teams. How do you collaborate with other team members? Answer. Collaboration is at the heart of successful surgery. I have experience working closely with surgeons, anesthesiologists, and other nurses. I prioritize open communication, adaptability, and mutual respect. Each team member has a crucial role, and I ensure that I contribute to a harmonious and effective team environment. 9. How do you handle and document incidents or errors in the operating room? Answer. In the event of an incident or error, I follow established protocols for reporting and documenting. I believe in a culture of transparency and accountability. These incidents are opportunities for learning and process improvement, and I take them seriously. 10. What do you find most rewarding about being a scrub nurse? And why do you want to work in this organization specifically? Answer. The most rewarding aspect of being a scrub nurse is contributing to positive patient outcomes and being part of a team that saves lives. I'm drawn to the NHS because of its commitment to providing high-quality care to all patients, regardless of their background or means. I want to be a part of an organization that aligns with my values and dedication to healthcare excellence. 11. How do you ensure the safety and well-being of patients in the operating room, particularly when dealing with vulnerable populations or patients with complex medical histories? Answer. Ensuring patient safety is my top priority. When dealing with vulnerable patients or those with complex medical histories, I start by thoroughly reviewing their medical records, including any allergies, comorbidities, or special needs. I communicate with the patient, family, and the rest of the surgical team to address these specific concerns. I ensure that all equipment and medications are double-checked for accuracy. If a patient is particularly vulnerable, I may request additional support or resources to enhance their care. 12. How do you handle situations when a surgeon and other team members disagree on the course of action during a surgery? Answer. Disagreements can arise, but it's important to maintain professionalism and prioritize patient safety. In such situations, I would encourage open communication to understand the differing viewpoints. If necessary, I would involve the charge nurse or supervisor to mediate. Ultimately, the decision should be based on what's best for the patient. After the surgery, I would participate in a debrief to ensure that we learn from the experience and make any necessary process improvements. 13. Tell me about a time when you had to adapt to a sudden change in a surgical procedure. How did you handle it? Answer. I encountered a situation where a scheduled laparoscopic surgery needed to be converted to an open procedure due to unforeseen complications. In this scenario, I coordinated with the surgeon to ensure that the necessary instruments and supplies for an open procedure were readily available. I communicated these changes to the rest of the team and ensured that we adapted seamlessly to the new situation. It reinforced the importance of flexibility and quick decision-making during surgeries. 14. What steps do you take to prevent and manage surgical site infections? Answer. Preventing surgical site infections is of utmost importance. I strictly adhere to aseptic techniques, including proper hand hygiene, gowning, and gloving. I maintain a vigilant eye on the sterile field throughout the surgery and ensure that all equipment and supplies are properly sterilized. Additionally, I provide post-operative wound care instructions to patients and educate them on the signs of infection, encouraging them to report any concerns promptly. 15. How do you handle the emotional and psychological challenges that can arise in the operating room, such as dealing with the trauma of certain surgical cases or loss of a patient? Answer. Emotional and psychological challenges are part of the job. I cope by having a support network both inside and outside of work. I debrief with colleagues after difficult cases and seek counseling or employee assistance services if needed. It's essential to separate work life from personal life and to focus on self-care to ensure I can continue providing excellent care to my patients. Remember to adapt these answers to your own experiences and the specific requirements of the job you're applying for. Interviewers appreciate real-life examples and your ability to handle challenging situations effectively. Don't forget to subscribe to the channel. Why not pop over to the career store for some premium merch? Thanks for watching. Thanks for watching.